Hi everybody, let's talk about glucocorticoids, which is otherwise known as steroids, or corticosteroids is another term. All right, so now glucocorticoids, it's a naturally producing hormone in your body, although we have medications that sometimes people need for inflammation or for Addison's disease or for asthma, which otherwise known as inflammation. And so we'll look here, and steroids are really made in the adrenal cortex. So the adrenal glands sit on top of the kidneys. And inside the kidneys, your body produces mineral corticoids, glucocorticoids, and sex hormones. So the mineral corticoids and glucocorticoids is what we're going to talk about. So there's some issues in your body that can happen, but your physiology is steroids have basically a huge effect on your body. You can't live without steroids. It has to do with your metabolism, how your heart is working, how things are happening during stress, effects on water and electrolytes, and respiratory system in children. So the mechanisms of the action is different from those of other drugs. So these steroid receptors are inside the cell, and what they do is they modulate the production of proteins versus the signaling pathways. So basically what it does is they help produce proteins to help your body work and function efficiently. It doesn't really go through like the signaling pathways like the nervous system. There's just receptors, and they go to the receptors and help produce the proteins that will help make your body function. So the main effects is anti-inflammatory. It can also suppress your immune system, has a huge effect on your metabolism and electrolytes. But when we think about taking these drugs, we think about rheumatoid arthritis, lupus, inflammatory bowel disease, other inflammatory disorders. Also, there's inhalers for people that have asthma or COPD. There's inflammation in the lungs. They can use inhalers. So I always say think of it as a super duper powered aspirin. I tell people that although it's not an aspirin, it's a steroid, but it's very has very high anti-inflammatory properties. Sorry about the dogs barking. All right, so as I mentioned before, asthma, sometimes if people have skin issues, so think of any type of thing on your body or in your body that's really not supposed to be there. We can try steroids to try to suppress that or reduce that inflammation in the body. So what are the adverse effects? So there's multiple adverse effects, but think of it this way. There's short-term effects and long-term effects. If you have a bad respiratory infection or an asthma flare-up, if you're using inhalers or taking some prednisone for a short amount of time, you're going to have short-term side effects where it can make you feel dizzy, it can give you insomnia, it can make you hungry, just make you feel a little more energetic. But then there's long-term effects, because remember, cortisone or cortisol is made in the adrenal glands, and if you get eventually you can get too much, and it can mess up that whole cycle with your adrenal glands and the cortisol excreting in your body. So it can mess that up. And so now you can start having issues such as you gain weight, you have stretch marks because you gain weight so quickly, your skin gets thin. So think about like if you have a steroid cream on, if you're using that for too long, I always say only use it for 2 weeks at the most, and then go to every month or so if you really need it, because it can thin your skin out and cause stretch marks. People have like the buffalo hump, you see the back there, and then their face, they get the moon face, as well as other skin issues. So it's really not a good thing to take. It's risk versus benefit. So some people actually need it, but some don't. So if you take it too much, you can mess up that adrenal axis, it's called, or cycle. And so you end up with Cushing syndrome, which looks like this. You see a lot of more apt females have it than males, but both can have it. You can have some fluid retention. Just think of like being big. You're just gaining a lot of weight. Other adverse effects, you can get some cataracts, glaucoma, peptic ulcer disease, and iatrogenic Cushing's means that you've just taken too many steroids and it's thrown you into a disease state called Cushing syndrome, which is an overproduction of cortisone. You have to be careful with some drug interactions such as insulin and some diabetes medications, and as well as be careful if you're taking other NSAIDs, the other anti-inflammatories. There's some contraindications. Those receiving live virus vaccines, because the one thing to remember with steroids or corticosteroids, it suppresses your immune system, and so you don't want a live virus vaccine. You want to be careful when you're breastfeeding and really not take it if you don't have to take it during pregnancy. You don't want to take it with the fungal infection because, again, you probably have a fungal infection because your immune system is down, so you don't want to take a steroid. So adrenal suppression means that you are actually suppressing the adrenal glands by not giving it steroids. So if your body's so used to steroids and then you just stop taking it right away, then you can have a steroid withdrawal, and it can suppress your adrenal glands and cause stress on your body, which can cause heart issues, etc. So it's very, you have to be real careful. Someone's on steroids for a long time, you don't want to just take them off it. You want to taper them down over a long period of time. Some people can't end up getting off them, especially if they have like rheumatoid arthritis and other disease states like that. They just need to be on it. They've been on it for so long, although the goal is to try to get them off that. They come in all sorts of ways. Orally, you can give them through the IV, IM, sub-Q, topically. So they've been around for a long time. There's a lot of them out there, and they all differ. So all of them would differ in half-life, the potency of both the mineral corticoid, glucocorticoid. Think of those as one and the same. So when you're picking something for a rash, there's different potencies. You don't want to put a strong steroid cream on the face to say you have a rash. You want to be careful with that versus if you have one on your leg. So there's all different creams with different steroid potencies in them. There's high potency, medium potency, low potency. And if you're giving IV steroids, you have your cortisone, Ciamedrol. It's basically you're giving that either because someone has an asthma attack and is in the hospital because they can't breathe, or you're giving those, someone has COPD exacerbation in the hospital. Sometimes we give IM to patients in an office setting because they have an asthma exacerbation, not serious enough for a hospital. We give nebulizer treatments and then give them some Ciamedrol or cortisone. Also, as far as the dosage goes, this arrow means tapering down. You usually want to taper down. So if someone comes in with asthma, then I'll usually do 20. And there's really no algorithm for it, so you can do 20 milligrams for 3 days, then 10 milligrams for 3 days, and then 5 milligrams for 3 days. Although taking it for such a short time, it's not going to hurt to just take 20 milligrams for 5 days and then stop, etc. So just know that for most things, you really need to taper down on steroids. You should not stop abruptly. It can cause insomnia, remember, because it works with that circadian, your 24-hour circadian rhythm, so you want to take it in the morning, so hopefully you can get some sleep at night. And then you also want to take it with some food. So as far as glucocorticoids, that is about it. And if you have any questions, just let me know.